Alright, first I'm going to start by verifying my hospital policy and order. Then I'm going to do hand hygiene. Then I'm going to identify the patient using two identifiers. I got Jaguar J. Jones, 82563, 82563. I'm going to explain the procedure to the patient. Today I'm going to be putting in an indwelling catheter. Then I am going to check for allergies using the chart and at the bedside. I got penicillin and penicillin. Now I'm going to evaluate the essential conditions that justify using an indwelling catheter, which is going to be acute ventilator dependent respiratory failure, acute worsening of mental status, and palliative or end of life care. Alright, now I'm going to gather all of my equipment. I'm going to don my goggles. I'm going to position my trash can beside me, and I'm going to perform hand hygiene. Now I'm going to raise the bed to a comfortable working height, lower a side rail, and position my patient into dorsal recumbent position with the legs bent. Now I'm going to apply clean gloves, and I'm going to do peritoneal care with soap and water. For a female, I'm going to do this starting at the distal labia, then proximal labia, and then down the middle. For a male, I would start at the urethral meatus, working in a spiral motion down, and I did that 3 times. Now I'm going to open my kit in between the legs. I'm going to use this as a trash can. Place that right there. I'm going to open my kit in between the legs. Now I'm going to remove my clean gloves, perform hand hygiene again. I'm going to don my sterile gloves. Alright, now that I've donned my sterile gloves, I'm going to remove my sterile field. Going to place it shiny side down in between the patient's legs, being sure not to touch the patient's sides. I'm not going to leave a gap in between this and this sterile field. Now I'm going to remove my tray. Place it closer to the patient. Now I'm going to prepare my my cleansing material. Should be iodine. I'm just going to verbalize that. Now I'm going to connect my water-filled syringe to the balloon port. Alright, now I'm going to remove the sheath from the catheter. Drop that in there. And lubricate 1 to 2 inches. For a female, I would lubricate it 5 to 7 inches for a male. Okay. Now I'm going to prepare the genitalia for cleansing, and I'm going to cleanse it with iodine. Going to spread it. Going to clean around the urethra opening. For a male, I would start at the urethral meatus and work down in a spiral motion, and I would do that 3 times. I'm going to inform the patient I'm about to begin insertion. I'm going to tell them to bear down as if voiding, or to take a deep breath and exhale upon insertion. I'm going to grab the catheter with my dominant hand. Well, I'm going to move the spots a little closer to the patient. I'm going to grab it with my dominant hand. I'm going to insert and continue inserting until I see urine return. Once I see urine return, I'm going to advance another 1 to 2 inches. I'm going to hold with my non-dominant hand, being sure not to contaminate this hand. Then I'm going to fill the balloon. Once the balloon is filled, I'm going to detach my syringe. Now I'm going to give it a gentle tug and then advance it slightly. Okay. Now I'm going to prepare my stat lock. Place this onto the patient's thigh to avoid damaging of the urethra. Okay, now I'm going to take my drainage bag, and I'm going to clip it to the side of the bed, being sure not to clip it to the bed rail. Alright. Alright, now I'm going to collect a sterile urine sample. Okay. Once the urine sample has been collected, now I'm going to discard of all of my supplies. I'm going to remove my gloves, my sterile gloves, perform hand hygiene. With my sterile gloves, now I'm going to lower the bed back down to a safe height, raise a side rail, position the patient for comfort, and then I'm going to do hand hygiene. I'm going to document the catheter size, the color, amount, and consistency of the urine. I'm going to document how the patient handled the procedure. I'm going to document the specimen that was collected, if indicated. I am going to educate catheter care with soap and water, and plans to remove the catheter as soon as medically indicated. Now, for discontinuing the catheter, I'm going to be using the aseptic technique. I'm going to be wearing goggles, and I'm going to empty the drainage bag into a graduated cylinder, and then measure the drainage. I would empty it to a graduated cylinder and then measure the drainage. I would take my 10 millimeter syringe. I would pull it back to 0.5 milliliters. I would attach it to the port, and I would let gravity do all the work. Once that is done, I'm going to remove the syringe. I'm going to remove the catheter. Okay, discard. And then I would provide peritoneal care. I would document the color, amount, and consistency of the urine. I would document the intactness of the catheter tip, how the patient tolerated the procedure, how much water came out of the balloon, and educating the patient on the signs and symptoms of a UTI infection, which would be cloudy urine, painful urine, and frequent urine. And I would assess the patient for assess the patient for voiding within 4 to 6 hours, or if not voiding, I would palpate the bladder or get a bladder scan.